situation. I think this is actually something's happened this year. It's not just West London. Something has changed in the NHS in the past 12 months because the whole country is in this sort of scenario. It's not just North West Thames.
Councillor Cowan.
Just looking at the CQC inspection of particularly the A&E at St Mary's, how surprised were you by the results?
Surprised and disappointed, yes.
Why?
Because having any of our departments where the environment is deemed as less clean and less satisfactory in terms of its environment that it should be is not something that we would expect and anticipate, and we were extremely disappointed about that.
I should probably give more detail to my question, but why were you surprised, given that for a long time you argued that there was a very intrinsic and professional level of planning going on in looking at the changes that were being made? And clearly part of that plan would be maintaining the standards of performance at the central A&E for Imperial. So why do you think you were surprised, rather than having an expectation and a consistent performance monitor of what the service was like?
So we had done, as part of our preparation for the CQC inspection, a number of things in terms of mock inspection visits. We had done a number of observations around all departments across the organisation. Clearly something that we've got to reflect on around our kind of action plan as a result of the CQC is why we didn't see some of these things in our planning, not just for changes in our emergency pathways, but in just observing our departments at that time. So there is a reflection that we have to make around that, and I think we will be taking the CQC action plan to our open board next week, and I think we are back with you again in several weeks' time, where I think we'll be specifically talking to you and about the CQC action plan and exactly these sort of things. So it is absolutely something, you're right, Councillor Cowan, that we have to reflect on. Why did we not see something that the CQC were able to observe? And that's something that as a senior team we absolutely have been reflecting on, and we'd be very happy to talk through that in the context of our CQC action plan when we're back with you in 2 weeks.
Well, I think it's worth exploring some of it now on the basis that clearly your role at this committee is to kind of explain how your plans for the future of our local NHS services are robust and well-founded. And part of that is to look at how well you plan. So I am aware that a lot of planning went into the CQC inspections. So can we just detail that first of all? So I'm keen to try and get a feel for how come this was such a surprise to you that the A&E in Paddington is failing when this has been so central to everything you've been arguing for the last few years. So can we just go through a few things? I understand you had, as you said, you had mock visits. You briefed junior doctors on the type of things inspectors might say. That included, for example, briefing doctors on who their reporting lines were within the management structure and wider issues. It was quite a comprehensive briefing plan for the doctors and all staff engaged in medical activity. And indeed, I saw stuff on your intranet where there was regular messages up about check this, if you're asked a question about that, say this. Could you give us a bit of a detail of what that preparation involves in order to put your best foot forward to the CQC? And then we can look at actually how that best foot didn't look too good as far as St Mary's was concerned in a second or two.
Certainly. So I think we, as I said, we had undertaken initially for each of our clinical services through the structures that we've got in terms of the departments, the directorates and the divisions, to undertake a self-assessment against the various domains that the CQC look at. So the CQC look at 5 domains of quality of service against 8 service areas. So we looked at self-assessment initially against their compliance with the CQC requirements. We then peer-reviewed that self-assessment. We then undertook a programme of mock visits across, again, those looking at the different domains, looking at the service lines and doing that by site, because the CQC inspect your organisation by hospital site as well as by their 5 domains. We did do extensive briefings. I think I probably would just maybe slightly temper what you said about that. We actually briefed the staff on what a CQC inspection is all about, what they will be coming to look at, and we were very honest with the staff in saying, actually this is a fantastic opportunity for us to showcase the very positive things that we do, but also to have a very detailed inspection which will give us feedback on the things that we don't do so well. So we encourage staff to speak openly and honestly about some of the challenges that they find at the Trust and to engage with the CQC very, very positively. So I think our proactive approach with the staff was to make sure that they were engaging with the inspectors, because for us this is all about actually learning how we can improve care for patients.
So what have you, given what happened, you've obviously had a period, a considerable period now to reflect on why that failed to get the standard you set and why you were so surprised. What have you learned about your own ability to monitor your own performance? 'Cause clearly that's a part of the failure, isn't it? If you're not aware of this and it takes an outside body to come in and point these things out, despite all the considerable effort, then that's a double blow given where we are in terms of planning the wider healthcare changes. So what did you learn about the failures of Imperial to identify these things for themselves?
So I think before I answer that, I think I'd say that we learned about a lot of the positive things, because we had some very good feedback about the engagement of our staff. We had some very good feedback about the level of caring of our staff for patients, and got very good results around that. So I think we had very positive feedback about many aspects of the care and the service that we deliver. I think a number of the areas that we had played back right from the start of the CQC inspection were areas that we had said that we know are deficient and areas of improvement. So we particularly highlighted some of our processes around outpatients. The CQC played that back to us as consistent with what they had found across the organisation. And so part of our action plan will be actually to accelerate some of the improvements, particularly in the areas of outpatients. The one area, as I said, was the St Mary's ED, particularly in the issue of around that sort of area of cleanliness. I think the issues around that were, we were clearly through some of our inspections not seeing to the level that we needed to some of the inherent issues in that environment that had built up over time. And that is a learning point for us about how we redouble our efforts around the inspection regime, the internal inspection regime that we need to be looking with the same kind of eyes that the CQC do around the environment as well as the care that our staff are delivering. I think it is important just to note that you said we've had considerable time to reflect. Actually, we acted immediately. So as soon as we had that information, even prior to the CQC producing its report, we were required to produce an improvement plan around that particular finding within the St Mary's ED. We delivered that within 3 weeks. We made the changes within that period. And my understanding is that the re-inspection that was undertaken in November actually now found the environment at St Mary's to be positive, and they have reissued the CQC report that now includes the re-inspection findings for St Mary's ED in the main report. So I think one of the things we have been able to demonstrate is when we are found to be deficient, we have acted as a senior leadership team extremely quickly, and our staff have responded magnificently. The question for us is, we need to be not in that position again in terms of being able to see those things and actually proactively deal with it.
Yeah, I think if you understand things from our positions, clearly we're here to represent people who elected us into office to do this. So we're seeing it's our job to ask the questions. And what we've seen in the last 6 months is a leak of an email saying finances they're in a mess, and the nature of it was so extreme. It looked like a lack of systematic approach to finances. There were similar answers when I raised this last time, that we've spotted this now, we've had the problems, we've fixed it, even though within the email it says you may suspend the foundation trust bid. Then a few months later, we know that we're getting told by doctors who work in your trust and nurses who talk to us that there's an awful lot of management around the CQC and preparation. Some of it is giving people ideas what to say and sending us different information. But despite that, then St Mary's, which is the jewel in the crown of the A&E, the Imperial's A&E offer, fails to hit the standard to the extent that, as you say yourself, you're surprised. And you put those two things together, and then you see and you begin to ask, is this an organisation that can spot things? As you said something very interesting, we need to see things through the same type of eyes as CQC do. Well, actually, that's all organisations need to do that. They need to spot problems before the wheels come off the lorry, as it were. So I'm saying that given the weaknesses in your ability to plan and manage those things and not see them on the horizon, it would raise wider questions for us about the quality of planning that's got into the preparations around Charing Cross and all the other issues that for many months now you've been asking the public to be reassured that you know what you're doing on the planning side. If you not see that would be a serious question, that you know what you're doing on the planning side, when you just begin to look at those type of key indicators, that there are some fundamental problems sometimes that don't get spotted within the Imperial's management team.
So I'm not completely sure how to answer that, apart from the fact to say that...
Well, you said, just to clarify, I'm taking you at your word, you said we're hoping to be completely honest and open, and I'm asking you for a completely honest assessment. If you see those type of indicators of failure, would it not raise wider questions for an onlooker? And you said there's difficulty in seeing it from the CQC's position. I'm asking you to see it from the public's position, that it's possibly indicative that Imperial doesn't have a robust enough management and an effective enough approach to planning to give confidence to some of the wider plans that you have around your A&Es.
So I think we are managing and leading a very complex system. I think we have got and have had significant forward planning around a whole range of things that we've been doing within the organisation. And I think we have got a leadership team that has had changes over the last 12 months, but has got a significant amount of stability in it now. I think if you look at what the CQC report was about the senior leadership team and the capability there, it was provided a significant level of endorsement, and the feedback from the staff was actually that there is real positivity in terms of how we are taking the organisation going forward. So from someone who is part of that leadership team, actually I am confident about our capabilities of running a complex organisation, but always happy to be challenged, as you will continue to do so.
You can see, I appreciate this, and just to underline, if you're saying you can't, you couldn't see it from a CQC side, so I don't think you're seeing it from mine and the public side at the moment. You're saying there's no cause for concern that there was financial alarm in September, and now alarm around the most central service, the A&E service of St Mary's now, and you're saying that doesn't cause question about some of the approaches and plans of the management team. So you're saying there's absolutely no cause for question over that.
What I've said is I'm sure that you as public representatives and the others that look to us to do the planning will continue to question. Our job is to continue to be able to demonstrate that we are engaging, consulting, planning effectively, and where there are issues that need to be addressed and are amiss, that we put them right rapidly. And I think on this occasion, with this particular issue with the CQC, we've done that. The issues to do with the financial position, I think you could not have failed to see that the financial pressure coming through the public sector and the NHS has been significant across the country. We felt that at the beginning of this financial year, and we have actively worked whilst also balancing our quality commitment to our patients. We've actually brought our finances back on track, which again shows, I think, some of the commitment and the capability of the leadership team. But it's a complex organisation to run, and we are very open to be challenged, and will engage with that challenge about how we're doing that and how we're planning for that.
But you'd agree getting the A&E right is the most fundamental, in any hospital you run, is the most fundamental thing you need to do. And that you were surprised by the results of the CQC. But you're saying somehow that has not, if I've understood you correct, you're saying that has not led you to question any aspect about your approach to planning or to the monitoring of that service, or indeed the resourcing and managing of it.
No, I think I said absolutely the opposite, that this is, as part of our CQC action plan, it has led us to question how we make sure that we are looking at these type of issues and our own internal inspection regime. That has got to be part of our own action plan and our review, because clearly it is something that...
So did you do an internal review?
An internal review
of how you got it wrong and didn't see this coming?
So we have gone back over and are going back over some of the mock inspections, some of our preparation that we did for the CQC, and that is forming part of our action plan. So,
and have you identified any of the key failings as yet, or is that still not been spotted?
So,
I mean, have you identified on top of what the CQC has said? Have you identified where you guys got it wrong, and why you were, as you say, surprised?
So all I can say is that there are the observations and the feedback that we were getting locally around the environment and the reassurances were clearly not sufficient. So that is calling into question for us about how we take that forward in the future. So it is something absolutely we are planning to learn from.
Yeah,
well,
I will just...
We've got a lot to cover tonight, so we are going to come back to this very issue at the next meeting, because we are taking the CQC report then